Welcome, everybody, to this week's departmental seminar. It is a great pleasure to have Daniel Béland speaking today. Daniel is joining us from Canada, where he is a James McGill Professor of Political Science and also the director of the McGill Institute for the Study of Canada. All of it, of course, at the McGill University, which then makes you wonder who might have left some monies in their will to establish that university. Daniel is a political sociologist with a broad interest. He's a comparativist, has published widely cross-nationally. So he's a director of the Institute for the Study of Canada, but actually is, I think, much more of a comparativist than somebody just looking at Canada. And if you look at his publications, 13 books he co-authored, 8 edited book volumes, 3 special issues he was in charge of, nearly 150 peer-reviewed articles. You can't write that much just on Canada. So he's a comparativist in comparative social and public policies, and really a leading author in the ideational literature. And I think it would be a very fair assessment to say that Daniel was, to a large extent, leading the literature, the public policy literature, from a very heavy institutions-focused into a direction that acknowledged to a much greater extent ideas and the importance of ideas in public policy. Today, Daniel has a very topical talk. He will be, as you know, because you're here, looking at COVID-19 responses in the US and Canada. And he has a framing of the two unidentical twins, which intrigued me a lot. Many moons ago, when I took a class in North American social policy, and the Americanist said, Canada, well, is the US minus crime but healthcare. So which might come possibly close to the unidentical twin theme, maybe. But of course, he was primarily thinking about the Anglophone part. So hopefully Daniel, as a Franco-Canadian, isn't offended by that very blunt summary of what Canada might be. But Daniel, the floor is yours. We're very much looking forward to your talk. Please go ahead. Thank you very much for joining us and being with us today.
Thank you very much, Timo. Thank you, everyone, for taking the time to, I know you have a busy schedule, even if most of you are at home, I'm sure, but trying to reconcile work and family, among other things. I'm really happy to be with you today virtually, and thanks, Timo, and the department for your invitation. Today, among other things, I will talk about the special issue of Social Policy Administration that was put online about 100 minutes ago, like less than 2 hours ago. And I'm really excited because I didn't know it will come out today, obviously. It's a surprise, and it's a good surprise because the timing is perfect, and timing is everything, especially when we talk about COVID. As you know, things are moving quite fast, sometimes often in the wrong direction, but in some ways in the good direction more recently in terms of vaccination, although there are ups and downs here as well. But today I won't talk about vaccination so much as early social policy responses to COVID-19 in rich democracies, in advanced industrial countries. This is what our special issue is about. And actually, I will share the screen to show you, just since I'm excited about the special issue, what it actually looks like. It just came out online. So social policy in the face of a global pandemic, policy responses to COVID-19 crisis. And the focus, as I said, is on rich democracies, although there is one article that deals with East Asia, and China as one of the cases. So I just want to show what the special issue looks like. So clearly the team here is Béa Cantillon, Rod Hick, Amilcar Moreira, and Peter Whiteford. We co-edited the special issue. And today I will talk a bit about our introduction, which was written by Béland, Rod, Amilcar, and I. And then I will talk about the contribution on Canada and the special issue. And then I will move beyond the special issue to give you something fresh and new and speculate also about the future, which is so uncertain. And I have some good news to bring to the table from the United States, believe it or not. I just want to go very quickly over this, the table of contents here. So in the special issue, in addition to the introduction, you have a more quantitative piece on social policy responses to the Great Recession following the 2008 financial crisis, compared with early responses to COVID-19, piece by Moreira and Hick. And then you have the piece on North America, and then you have quite a few pieces on Europe, Nordic welfare states. Each article focuses on several countries, between 2 and 4 per article. So I won't go over all the countries, but there is the Nordic welfare state. So we use, Esping-Anderson's typology plus more recent types of welfare regime to map our case selection. So after the social democratic welfare states or Nordic welfare states, we have 2 European liberal countries, or the UK and Ireland. Then we move to continental Europe, then Southern Europe, Eastern and Central Europe, and East Asia, in this case, Japan, South Korea, mainland China, and Taiwan. And finally, there is a shorter piece on the European Union and COVID-19. It's a special issue that was put together quite rapidly. Obviously, as you can imagine, we had this idea to put together a special issue on Twitter at the very beginning of the pandemic. And then we invited colleagues to write in the early spring. And the papers were submitted to the journal in August and September. And some of the pieces started to appear online later in the fall. And now the special issue is up on the website, the Wiley website of Social Policy and Administration. So today, the first thing I will do, and I will move to my slides, share the screen again. I will talk about some of the general lessons of our special issue. What they mean from a theoretical standpoint, because an issue that I have with some of the early stuff on COVID-19 is that it's very descriptive, theoretical, and it's really hard to theorize on the fly, really. So we have to be very careful about the lessons, the theoretical and comparative lessons we draw from these responses to COVID-19, even if we only focus on early responses, which is basically the responses enacted last spring and last summer for the most part. So the special issue really focuses on, say, March through July or June of 2020. But I think that COVID-19 could have a lasting impact on social policy, but we have to be very careful when we speculate about it, because I really much remember what people were saying about the 2008 financial crisis, and now it will move social policy in many different countries towards really progressive agenda. And we saw not so long after that austerity kicking in quite a few countries in Europe, including the UK, as you know very well, too well. So I would be very careful about, predicting the future. I don't predict the future. I don't think that social scientists or social policy scholars are really good at predicting the future, but I will try to draw early lessons from COVID-19 and think about what might happen towards the end of this presentation. This is based on collaborative work in large part, so I will acknowledge, of course, my wonderful collaborators here. So what I will do today is, in a way, present 3 papers. The introduction of our new special issue. I will just talk about the main arguments that we put forward in that introduction that summarize some of the takeaway lessons of the special issue in terms of early social policy responses to COVID-19 in Europe, North America, and East Asia. Then the second part of the presentation will draw on the co-authored contribution of that special issue on Canada and the United States. And finally, it's more prospective. I will talk about a paper that we haven't written yet, but we want to write with some of my colleagues about the potential consequences of social policy responses to COVID-19 in terms of inequality, especially poverty reduction. And in this case, I will focus once again on Canada and the United States. Now, why do I use this term unidentical twins? And this is, Timo alluded to that. This goes back actually to a special issue that I co-edited with Alex Wadden, my friend Alex Wadden, a special issue of the Journal of International and Comparative Social Policy that appeared in 2019 before the pandemic. And our introduction was titled Unidentical Twins, Recent Social Policy Developments in Canada and the United States. So why are we talking about unidentical twins here? I think the issue that's important when we talk about Canada and the United States is that in the social policy literature, famously, Esping-Anderson classified them as liberal regimes. And some of you all know, have some issues about the concept of liberal regime, how it applies to the UK and other countries. But in Canada, we have some issues with how it applies to our own country vis-a-vis the United States. It's quite clear to me that when Esping-Anderson thought about the liberal welfare regime, the country that he had in mind, I say front in mind, even more than the UK, was the United States. For us in Canada, there are some issues about how this idea of liberal welfare regime fits to the Canadian social policy system, to the Canadian welfare state. There is quite a bit of literature stressing the differences between social policy in Canada and the United States. For example, with Alex Wadden, I published a few years ago, I think 2017, an article to explain why Canada has universal social programs in terms of healthcare and pensions, something that we share with the UK, but that we don't share with the United States. So key differences in terms of policy design. In social policy administration, more than 20 years ago, John Miles, my friend John Miles, wrote an article in social policy administration about how to design a liberal welfare state. And it's, paraphrasing the title here, showing the differences in policy design between Canada and the United States. So part of the same regime, perhaps, although some people in Canada even refuse to, acknowledge or recognize that idea that Canada is part of the liberal regime, but certainly there is a sense that there are key differences in terms of social policy between Canada and the United States. At the same time, there are similarities. When you look at spending patterns in terms of percentage of GDP, Canada and the US are quite similar. The US is actually a bit higher than Canada, and we are both below the OECD average. Both countries are below the OECD average. Also, when you look at specific policy areas, you see that there are quite a few similarities between Canada and the United States in terms of unemployment insurance or pensions, although there are still differences, but there are big differences in other policy areas that Esping-Anderson didn't talk about in his 1990 book, The Three Worlds of Welfare Capitalism, like healthcare. And here, of course, the United States is really unique among advanced industrial countries in terms of healthcare for not having universal coverage. So again, Canada here is different from the US, but all European countries are as well. So before I talk about Canada and the United States, and I discuss social policy responses to COVID-19 in these two unidentical twins, which is the main topic of my talk, let me tell you a few things about our special issue, a few more things, and especially the introduction that just appeared online today. So the key questions that we ask in the special issue and that we discuss in our introduction are, how have welfare states responded to the coronavirus pandemic? Have they implemented largely the same policy responses, or have countries responded differently? And if they have they done so in institutionally predictable ways? So in our special issue, I went over it already. There is one large-end comparative paper and in-depth case studies, comparative case studies, focuses on countries in different regions of Europe, in East Asia, and in North America, complemented by an introduction and a shorter piece on the European Union. So these are the three main findings of the special issue as we identify them in our introduction. And we wrote the introduction, we were on a tight schedule here. Our contributors, all the contributors to the special issue have not read this introduction yet, so they might disagree with some of our takeaway lessons. But I think these are things that we find across many of the contributions of the special issue. Three main findings or three main issues that are important to stress when we study the early social policy responses to COVID-19 in the three regions of the world that I mentioned earlier. First, the design and scope of the emergency policy responses vary sometimes from country to country in ways that reflect existing national policy legacies. Early responses to COVID-19 that seek to reduce insecurity, stabilize incomes, and prevent an economic freefall are shaped by existing policy legacies. And that is not surprising when you know the literature on policy feedback and also on welfare regimes, that there is continuity over time, even during times of crisis, even during emergencies. Second, the responses to COVID-19 in the field of social policy are generally grounded in emergency Keynesianism, and at a deeper level, they are an integral part of a broad historical trend according to which welfare states work to preserve rather than challenge the core institutions underpinning capitalist market economies. Social security systems here prove to be a strong automatic stabilizer, or they act as automatic stabilizers. And of course, in a context where deficit spending became the rule, even in countries that had faced austerity in the not so distant past, emergency Keynesianism kicked in, at least temporarily. We'll see what happens in the years to come. And measures were enacted to really save markets and save the economic system from an economic downfall, a free fall, really. It was so sudden, as you recall. I will mention some numbers about Canada and the United States later, but all these figures are in our introduction and also in the comparative paper by Amilcar Moreira and Rod Hick. So we have the numbers, and also in each of the individual articles, small n comparative articles, you have the numbers about the economic situation and the economic crisis triggered by COVID-19 and the public health emergency measures enacted during the pandemic. Third finding, so the first finding, there is continuity, existing policy legacies matter. Second important finding or argument here is that emergency Keynesianism is found to be influential across the different cases, and there is this push to really spend a lot to basically save the economic system from a free fall. Third, COVID-19 emergency policies were inherently different from the austerity and work-related policies pursued in some countries in the decade before the beginning of the COVID-19 crisis. The question, of course, is whether after the pandemic is over, or after most people who want to be vaccinated are vaccinated, will we return to austerity in the countries that face austerity over the previous decade and in other places, or not? And I cannot answer this question today. And my focus will be on North America, Canada and the United States. And in Canada and the United States, we didn't witness social policy austerity that much over the last decade or in the aftermath of the financial crisis, the 2008 financial crisis. So I won't really, the jury is out, I think, about what will happen next, especially in Europe. And that's not what I will talk about later today, because now, later in my talk, because now I will focus exclusively, or at least primarily, on Canada and the United States. But I wanted to start with the big picture, telling you what are the general findings of our special issue as they are outlined in our introduction. North America during COVID-19. Well, it's been a tough ride. And it's been tough. And here, this cartoon by McGill from the Hamilton Spectator, which is an Ontario-based newspaper, I think captures the sentiments in Canada at the beginning of the pandemic under Trump. If you look at the numbers, I don't want to bomb you with numbers, And there are numbers, of course, in our article about Canada and the United States, I will talk about now. But I want to give you some updated figures. The United States did worse than Canada in terms of fighting COVID-19. In terms of the number of cases, we talk about more than 29 million in total. Of course, the US population is 8.7 or 9 times bigger than Canada, but in Canada, we only have about 900,000 registered cases. So even if you multiply 900,000 by 9, you're still way below the US figure. And also in terms of number of deaths in the United States, almost 535,000. In Canada, it's 22,000, about 22,500 since the beginning of the pandemic. These are the numbers from yesterday on the Johns Hopkins University website. So these are the updated numbers, but we have older numbers in the special issue for you to look at. In terms of the economic, one thing I want to say about these numbers, of course, is that there is tremendous regional variation between these countries. These are huge countries from a geographical standpoint, right? Among the largest countries in the world in terms of territory, Canada is much more sparsely populated than the United States. Basically, most of us live very close to the US border, 150, 200 kilometers from the US border. So sparsely populated, but it's still very long if you look at the US-Canada border. And if you look at the east to west, Atlantic provinces out east, so Newfoundland and Labrador, Nova Scotia, Prince Edward Island, New Brunswick, these provinces did relatively well during the pandemic. But other provinces like Quebec, where I stand in front of you today, did really face a much more difficult situation. Quebec was by far the province the most directly affected by the first wave of COVID-19, and during the second, followed by Ontario. During the biggest province, the country, Quebec is the second largest in terms of population. But during the second wave in the fall, we saw Western provinces facing major challenges. Manitoba, Saskatchewan, and especially Alberta. British Columbia out west did relatively well, but again, ups and downs. In the United States, you have also regional variation over time. We know the pandemic, its effect was first felt mainly in blue states, in large states like New York State, and that may have affected Trump's early response to COVID-19, which was problematic to say the least. Okay, the federal government did not take a strong leadership in fighting COVID-19. In Canada, the federal government maybe took a bit more leadership than in the US, but Canada is, like the US, a very decentralized country. And in terms of public health measures, most of them are really at the local and provincial or territorial level, not at the federal level, except when you talk about, say, border controls and immigration and so forth. But overall, the provinces and municipalities have played a central role in terms of public health measures. That's the same thing in both Canada and the United States. But when we talk about social policy responses to COVID-19, especially income support and social protection, the federal government is absolutely crucial here, especially in Canada. So let's talk about that. Let's talk about this article. So that just now is part of this new special issue of Social Policy Administration. It was written by Shannon Denon, Phil Rocco, Alex Wadden, and I. And what we show in this article, to summarize the main claim here, is that the two countries engage in at least the initial responses, so the first few months of the pandemic, the two countries engaged in highly divergent approaches to social policy making during a massive public health emergency. There was emergency Keynesianism deployed in both countries, but there were significant differences in policy design, in what actually happened, the form that emergency Keynesianism took in both countries. And what we argue in our article is that in terms of stabilizers, from an economic standpoint, Canada did a better job and moved faster than the United States. So here during the pandemic, as before, Canada and the United States were unidentical twins. Again, to quote the title of the introduction to a special issue with Alex Wadden, we published in the Journal of International Comparative Social Policy before the pandemic. So we draw evidence from the first 5 months of the pandemic, and what we see, and it's quite striking, especially in the area of unemployment benefits, which I will focus on today, because our articles discusses a lot of issues dealing mainly with income support, wage subsidies, housing, even. There's a few paragraphs on healthcare, but the focus is primarily on employment and unemployment policies. And here in that area, Canadian responses were both more rapid and comprehensive than those of the United States. This variation can be explained by analyzing divergent political institutions, pre-existing policy legacies, and variations in cross-partisan consensus. And in the US, of course, under Trump, the level of cross-partisan consensus was very, very low. A lot of fights between Trump and the Democrats in Congress, especially in the House of Representatives with Nancy Pelosi, because, of course, Democrats control the House and the Republicans under Trump control the White House and the Senate. That complicated things. But there were also, in addition to this lack of cross-partisan consensus and the fragmentation of political institutions in the United States, the multiple veto points that you find, the House as a veto point, the Senate, the White House. In addition to these factors, pre-existing policy legacies played a major role, especially when we deal with benefits for the unemployed. And this is what I would like to focus on today. And that goes back to one of the major themes or findings of our special issue in general, the importance of existing policy legacies to account for specific responses to COVID-19, emergency responses in terms of their policy design. When we talk about these existing policy legacies in terms of unemployment insurance, we do have really a major contrast between Canada and the United States. So I mentioned already power fragmentation, partisan division in the US under Trump. But in terms of policy legacies, I think the most important thing to understand is that Canada has a centralized unemployment insurance program, which is known as employment insurance, okay? So we have a centralized federal system. While in the United States, it's a decentralized system where you have 50 different unemployment insurance programs. Each state has its own unemployment insurance system. Although the federal government plays a direct role in funding these systems, especially during emergency periods, the fact that it's so fragmented complicates policy implementation. And also there is an unevenness in benefit levels and eligibility criteria, and also problems in terms of implementation because of the bureaucratic capacity of each state is different from the next. And so that creates major challenges. From a purely Canadian or macroeconomic standpoint, Canada, because our system is more centralized, the federal government can actually act more rapidly. And in fact, in Canada, we didn't use our employment insurance program to deliver money to people. The federal government just sent checks to people who applied online. So we didn't use employment insurance, but because the federal government was already in charge of that policy area, it decided to not use social insurance because it's too complicated to process millions and millions and millions of claims. Don't forget here the context. Unemployment in the United States was on, before the crisis, before COVID-19, say in late 2019, was only 3.5%. And by June, it was 11.1%. In Canada, in 2019, unemployment rate was only 4.8%. And by June 2020, it was 12.3%. Okay, so very dramatic increase in unemployment. And Canada decided we have a more centralized system. The federal government said, just people who need money, you have lost income, apply for it, we'll send the money and we'll check your eligibility criteria afterwards, okay, through the tax system. when you file your income tax for 2020 the following year, which is basically now, okay? That created some problems. But Canada adopted a much more centralized approach to relief for the unemployed and people who lost a lot of income. And the main program, the flagship here, was the Canada Emergency Response Benefit. Massive yet temporary program that ended already in the early fall, in early October. But this program allocated $82 billion to 8.9 million people. Now, the Canadian population is about 38 million. So 8.9 million people, that's a lot of people in a country like Canada. The CRB provided 500 Canadian dollars a week for up to 16 weeks. But these are taxable benefits. And it's for workers who lost their income because of COVID-19. So not only people who lost their job altogether, but people who had witnessed a massive drop in their income because they had to move part-time and so forth. So this program pumped up a lot of money into the economy and into the households in a very effective way. Even if now there are some issues about people who applied for it and were misled about the actual eligibility criteria, and now they have to repay this money because they were not eligible, but we only checked eligibility criteria months after people received benefits because it needed to be really fast, and we were really fast. The money flooded really, and so that was very effective from a macroeconomic standpoint and from a social policy standpoint. But then there's a discussion in Canada about forgiving some of the people who apply for the benefit, and they really, it was in good faith. They didn't want to cheat or whatever, but they were misled in applying or didn't understand the system. And so some of these people will be forgiven, but there is still a discussion about this in Canada. In the United States, as part of the CARES Act, which was signed by President Trump in late March 2020, there were some key measures for unemployment insurance, federal measures to help the states and help the unemployed all across the country. So they extended regular unemployment benefits by 13 weeks. They had a pandemic unemployment assistance program, also boosted benefits by $600 per week as part of another temporary program. So the federal government did put a lot of money on the table, but this money had to trickle down to the unemployed, to people through the states. And the states have different eligibility criteria, as I mentioned earlier, and also administrative capacity. So some people waited a long time, way longer than in Canada, to get their checks, to get their relief, right? People who were directly affected, very suddenly affected by COVID-19, they had to wait weeks and weeks more than their counterparts in Canada often to receive the money. And also some states, in some, especially Republican-controlled states, GOP-controlled states, there was some political, let's say they were sometimes dragging their feet. So they were accused of dragging their feet, as was the case in Florida, for example. So this decentralization of unemployment insurance in the United States, I think, slowed down the relief effort in a way or on the ground. Also, U.S. politics complicated not the enactment of the CARES Act, but the enactment of other stimulus packages. We know, for example, the two biggest packages, there was one signed by President Trump in December, and one very recently signed by President Biden last week. And I will talk about that last legislation, but it took a long time, especially for the second big stimulus package under Trump, to be passed because Republicans and Democrats were fighting over this. In the context of this divided government and a very high level of partisan conflict, something that is really dramatic in the US and something that is simply not at the same level in Canada. In Canada, the parties worked together really well at the beginning of the pandemic in the context of a minority parliament. So we have a minority Liberal government and the Prime Minister is Justin Trudeau. And the Liberals were able to work with opposition parties to get things done really rapidly. In the US, the situation was quite different. and also in terms of intergovernmental relations in this decentralized federal system, there was a lot of fights, open fights between President Trump and some Democratic governors. While in Canada, at least for some months, the existing fights between Ottawa and the provinces calmed down. They moved to the background. And now they fight over healthcare funding and so forth, but it's not the equivalent of what we saw last year under Trump, which was really a gong show. If you remember this US show from the 70s, Gong Show, it was really a gong show, and it affected the social policy responses to COVID-19. All right, so now I want to move to a different, I want to look at the future, because I just told you what happened in Canada and the United States in terms of early responses to COVID-19, focusing on unemployment benefits and benefits for people who lost their income. But now I want to think about the future and what will happen moving forward. What could be the long-term consequences of social policy responses to COVID-19? And I want to focus here on inequality and especially poverty. And here, this is something that we are thinking about doing with Shannon Dinnan, Phil Rocco, and Alex Wadden, the people who I wrote this article that I just talked about in social policy administration for a different special issue. We are thinking about writing a piece focusing on the impact of these social policy responses of COVID-19 in terms of inequality and especially poverty in the long run, whether they will have an impact, whether some of these measures could become permanent. Also, the design of these emergency measures, whether they were more effective in fighting poverty or not. So this is really about talking about a paper that has not been written yet. And now I will fly solo because I will talk about an idea that I got overnight, well, actually in the middle of night, very early Friday morning. And so this is what I think we could talk about. But here I go on my own, and we'll discuss this with my co-authors later about what we'll do in the paper itself. But I want to deal with this issue of whether there will be long-term consequences of COVID-19 on social policy, focusing on the issue of inequality, especially poverty. Now, and the reason why I want to talk today about poverty, and that will be certainly a key issue in our article, in addition to the fact that poverty is always a major issue in liberal welfare regimes in both Canada and the United States. We have a new president, of course, in the US, and the new stimulus bill that he signed last week is really quite dramatic in terms of poverty reduction. So there is some really interesting developments in the US right now. And now I will talk about comparing the two countries in terms of in what direction we are going in terms of social policy responses to COVID-19 and beyond, in relationship to the issue of income support for low-income people and poverty reduction. So I don't have that much time here, I know, so I will try to be concise. The design of policies enacted during the pandemic are really important in terms of calibration. And some policies targeted lower income people, or they were universal, but in a way that actually favored lower income people, especially when you talk about Canada, for example, when it's taxable benefits. Obviously, higher income people, the money can be clawed back later. Some of the money can be clawed back later. So there are a lot of interesting issues here in terms of the design of emergency measures and how they relate to issues like inequality and poverty reduction. But although poverty is an important issue here, it's not just about policy design of emergency measures, it's also about agenda setting. And where we are going when we are hopefully exiting this pandemic with the vaccination process, what will Canada and the United States, the federal governments, that's what we focus on, will do in terms of social policy reform? Will they enact social policy reform that will actually focus on improving the welfare state and equality and reducing poverty, which increased in both countries as a consequence of COVID-19, and which poverty was already high, especially in the US before the pandemic. So is it in the direction we are heading, or will we actually focus on other issues like healthcare reform, which are not about income support per se, although in the US, the link between healthcare and inequality is very strong. It exists in Canada, but it's even stronger in the US. So what I want to talk about here is agenda setting, and where is the policy agenda right now in Canada and the United States in terms of social policy in the aftermath of COVID-19. So if you talk about Canada right now, the big issue, the ticket item on the agenda in terms of social policy is long-term care for older people. Many of old people died during the pandemic, which is the case all across the world. But in Canada, these deaths were related in large part, in some cases, with major problems facing long-term care, the long-term care system. That was especially the case here in Quebec, but also in Ontario and other provinces. And the debate right now is about the federal government allocating more money to the provinces for long-term care, because the provinces are in charge of long-term care. But the federal government and Justin Trudeau are talking about having national standards in exchange for federal money. So there is a debate about fiscal federalism in this country. In addition to that, there is the debate about healthcare funding in general, the fact that the federal government only funds about 22% of healthcare funding, of the healthcare systems. We have 13 healthcare systems in this country, in Canada, one per territory and per province, 3 territories, 10 provinces. It's very decentralized, but the federal government does play a major role in terms of financing healthcare, and the premiers have been pushing Ottawa since the late summer and the fall to increase healthcare funding in the long run, not in a temporary way, because the federal government did send emergency funding to the provinces to help them cope with the public health crisis on the ground. But they want a permanent increase in healthcare funding. So they want to they don't want this crisis to go to waste, use this COVID-19 crisis to have a permanent increase in federal funding that they receive from Ottawa to run their healthcare system. So that's a huge issue in Canada. We have been talking about that for decades, the role of the federal government in health funding, but the COVID-19 crisis has moved this issue to the forefront of the agenda. So long-term care and healthcare more generally are the forefront of social policy reform in Canada. Income support and poverty reduction right now are not, even despite the fact that we have the employment insurance program that we have is flawed, and that's why we didn't use it to address COVID-19. When we enacted an emergency benefit, we basically pushed EI aside temporarily to send money to people, because EI itself, employment insurance, in normal times only covers about half or maybe half of people who lose their job in this country. So it's a flawed system. And it's the same thing for provincial social assistance, which is quite meager, especially when we talk about unattached childless individuals. And so there are a lot of challenges in terms of poverty reduction and income support in this country. But right now, healthcare and long-term care are taking a lot of space. This is not the case in the United States. And I want to talk about the American Rescue Plan Act, which was signed by President Biden just last week, $1.9 trillion. This is enormous. The previous stimulus bill that was signed by President Trump in late December was about half of that, right? And the CARES Act from late March 2020 was above $2 billion, $2 trillion, sorry, above, I think it was 2.1 or 2.2 trillion dollars. But 1.9 trillion dollars is a lot of money. And what's interesting about this stimulus package is not just that it extends benefits for the unemployed that I talked about earlier, that there is more money for healthcare and a lot of things, is that there are measures here that are designed to fight poverty, and that could become permanent. Key here is a fully refundable child tax credit valued at $3,000 for kids for each kid age 6 and 17, and $3,600 for kids under 6. So this could lead to a massive decrease in child poverty in the United States. This is temporary, but many Democrats want to make it permanent later this year. And if such a measure, or even a scaled down version of this measure, will become reality, that will go a long way in really improve US's family policies, which are really meager compared to other countries, including liberal countries like Canada and the UK. Okay, so that could be game changing if the Democrats actually make some of these measures permanent, including this the expansion of the child tax credit. That could have long-term effects in the United States. And it's so dramatic that the New York Times recently, and that was unexpectedly, they referred to Biden as a crusader for the poor. Now, Biden ran a campaign as a uber centrist candidate, right? He was a centrist. He was really going to, basically bring back sanity in the White House. He talked a lot about the middle classes, but very little about the poor. But what happened during the campaign is that the Black vote, African American vote, played a major role, and Biden will not be president today without what happened in Georgia, for example, which would have been impossible without strong African American turnout. And it's the same thing for Democrats control the Senate because of the two runoff elections that took place in January. And so I think they owe a lot to minorities who are more likely to fall into poverty, including and especially during the pandemic. I'm not sure if there's a direct link between this and that, but certainly progressives within the Democratic Party are pushing for Biden to adopt an anti-poverty agenda. And we see that very clearly in this American Rescue Plan Act. And again, it could have long-term consequences. Again, it's not sure yet, but it's very important. And it moves also poverty reduction to the forefront of the policy agenda, which is very important. This being said, let's say they make permanent some of these measures regarding child tax credit, for example. The next step after that will be to deal with healthcare, because the United States is still, as you know, a country that doesn't have universal healthcare coverage, a country where you have about 12.5% of people without. That's data from the Commonwealth Fund. 12.5% of people without healthcare coverage, 9.5 people who are uninsured but have a gap coverage temporary program, and then you have 21% of people who are underinsured. So they are covered for some things but not others, which could in the end mean that they will have to pay quite a bit out of pocket. So healthcare insecurity is a big issue in the US, and it's directly related to poverty and inequality. So the next step, if they can improve their family benefits, which are, again, very, very low on average. Parental leaves, maternity leaves also, they don't have even the legislation on paid maternity, parental leave in the US, one of the few countries that doesn't have that. So there's a lot of work to do in that area. And I think the American Rescue Plan Act is a step in the right direction, especially if Democrats act upon this will to actually make some of these measures permanent. But then a much more difficult challenge would be to fix the healthcare system. We know passing Obamacare was tough and contentious. There's so much money at stake, big interest groups, the insurance companies, physicians, private hospitals, and so forth. So I think the next step would be to try to fix the healthcare system, improve Obamacare, and that may take time. I'm almost out of time, so I will conclude here. I just want to tell you, just to have an idea of the scope of the American Rescue Plan Act. And there is significant money here for social policy in terms of expanded child care credit, earned income tax credit, so measures targeting lower income people, a lot of course, money to target the unemployed, money for state and local governments. So it's not all about, of course, poverty. It's about economic stimulus, but there is a significant component that's explicitly, directly about poverty reduction, which I think gives me some hope, especially considering where the agenda is in the US and who controls the Senate right now, and the White House is certainly much more hopeful than it was just, say, last summer. Now, I will move to the last slide here, the conclusion. So our broader analysis of Canada and the US really shows how the social policy responses to COVID-19 prove bolder and faster in Canada than the United States. I'm talking here about the early responses. Because of a combination of three factors. I mentioned policy legacies, greater centralization of unemployment benefits in Canada than the United States, political institutions with greater fragmentation in the US, and elite consensus, which is, let's say, stronger in Canada or more collaborative, certainly work among political parties in Canada during the COVID crisis than in the US under Trump and beyond. Although the measures I've talked about in terms of the early responses are generally temporary in nature, the longer the pandemic and the related economic downturn lasts, the more likely it is that permanent changes to the welfare state occur. And here I see the American Rescue Plan Act as something that could really set the agenda for poverty reduction and really social policy reform in the US. But the next step in the US is healthcare. In Canada, we need to fix our long-term care system. Healthcare is high on the agenda, but we have to fix our income support for the unemployed and the poor, social assistance and employment insurance programs that are flawed, deeply flawed. And right now, reforming these programs is not high on the agenda. And I think we should really rethink this and not put all our eggs in one basket, which is about healthcare, and think about income support and poverty reduction. Something that the Trudeau government, to give the government credit, they did very extensively early on when they formed a majority government from 2015, late 2015, 2019. For 4 years, they invested a lot in child benefits, and they contributed to a significant reduction in child poverty. But the work is not done, and I think that we need to make sure that these issues, poverty reduction and redistribution in terms of income support, have to remain on the agenda in both countries. Right now, it is in the US. And I think that in Canada, we have to fight for these issues to stay up there, maybe below healthcare, but still central. And in the US, the next step is, of course, to think about healthcare reform, but that's much more complicated than enacting a federal child credit because of federalism and because of all the private actors, for-profit actors and non-profit actors who play such a central role in this very fragmented, complex, and unique healthcare system. Thank you very much. It's time for questions.
Well, thank you very much, Daniel, for bringing the North American debate to Europe and introducing us to what happened in Canada and the US, and also provide us with an outlook of what might be happening in the years to come. The floor is open for questions on what Daniel presented. So please, if you do have a question, raise your hand. Kitty, please. Kitty.
Hello, hi, thanks very much. Very, very interesting to hear the Canadian-US discussion. I wanted to ask a bit more detail about the provision particularly in Canada, I guess, because it didn't sound so $500 or whatever you said for 16 weeks. Yeah. That doesn't sound very good, given it went on for a lot longer than 16 weeks. So here, we've had the furlough scheme that keeps being extended, which has provided 80% support to a lot of employees. So I wanted to ask you first about that. And secondly, about self-employed workers who are self-employed or kind of gig economy workers, and whether they were covered, and whether is that part of the group that is having to now pay all this back because they weren't eligible? Is that part of the issue there?
Yes, no, these are a very good question. So the CRB is true, it's not that generous, but for lower income people, it really provided a major boost. And it's not the only policy. Now, I haven't talked about the wage subsidy program, which is federal wage subsidy program. And this program is actually, is still working. It's temporary, but it's very important. And it has helped a lot of Canadians to keep their job. So I think that it's important to keep that in mind, that there is other programs than CRB, and I just focus on CRB because it was easier, but there is extra child benefit, for example, temporary, that I didn't mention. So there's more than $2,000 a month for many families, right? But what's important here, when you talk about the self-employed, if they lost income, they were eligible. Okay, so, and that was an advantage over the employment insurance system, and that was so CRB covered way more people than employment insurance will have. So much broader coverage, but it's not income maintenance because it's not earnings related, right? It's a flat amount. It's a universal program. It's flat. And so for higher income people, it's not as good. But for low income people, that was a major boost. The people who applied for it but didn't qualify were, for example, people who were on provincial social assistance. And they thought, oh, you can apply for this and get money. But these people were not eligible. So there are, and so just an example among others, or people who didn't lose enough income to qualify, and now they have to repay, or they might have. But it seems that the government said it will be relatively lenient about this, right? And so, yes. Also in Canada, so the amount in dollar, the cost of living, it depends where you live and so forth. I think that $500 a week in Toronto is not that much, but $500 a year in a small town, suburb, or is better. So I'm not saying these were very generous measures by any standard, but these were very rapid. It happened, and the money started to flow right away. Immediate support, and that was, I think, really successful from a macroeconomic standpoint. But it's true that this is still liberal in the sense that the checks were not that high. So these are trade-offs. But way more people receive money than they will have received under the EI system. Way more people qualified.
I suppose
yes.
More than the amount, I was thinking just of the length of time, and that's for 16 weeks.
Yes.
Would take one to June or something.
Yes.
And then what?
Yes.
Because
so
here we've got this constant sort of cliff edges coming when they say the scheme's going to end, and then they have to keep extending it. So
there is the employment insurance program, which was also tweaked for that. So people who are already on employment insurance, there is a transition, and that's the problem, is that we now have a transition for people who move from CRB moving to employment insurance, but then we don't know when this transition is over, what will happen. We're talking about, what I'm thinking about is long-term reform of employment insurance. So again, like in the US, you tweak the system to help people in the short run, but it's not a permanent fix. And that's what I'm thinking about here, a permanent fix. CRB was not a permanent fix, and helping people on EI with extra benefits, as we are doing now, to ease the transition is temporary. And so what I'm hoping is a permanent fix of employment insurance, and maybe also starting to think about provincial social assistance. So income support for the unemployed and low-income people. And I think we did a pretty good job in the short run. But in the long run, I think that it's there are still major challenges.
Timo, you're on mute.
Sorry. First Johan, and then I hope I don't pronounce it too poorly, Guangdong. After Johan, please. Maybe we take two questions in one go, and then Daniel focuses what he likes better.
Sounds great. Thanks, Timo. Daniel, thank you for the talk. I'm going back to how you opened the presentation with expressing an interest in trying to figure out how to theorize the moment, and the specific challenges of trying to theorize this moment. You posed the research question here as being as one of how countries' welfare states have responded to the pandemic in, I wrote this down, in institutionally predictable ways.
Yes.
Now, the question I'm going to pose is what that means, what it means to think of something as institutionally predictable. Political theorists at the moment are doing all sorts of mental acrobatics at the moment about trying to figure out what emergency governance even means. Option one is emergencies mean that you have to keep doubling down on your underlying commitments. Emergencies expose your underlying commitments. Option two, emergencies mean you govern differently. And I'm trying to figure out institutional predictability. Like, how do we make sense of these two options? I hope that question makes sense.
Yeah, no, it absolutely makes sense. And it's something we'll tackle in another special issue, but on federalism. So I can give you an example about institutional predictability when we deal with federalism. So Canada and the United States are two federal countries. Canada is already in charge of employment insurance. And so it took over, and there was no question that the federal government will send checks directly to people. In the United States, although there is that, checks are sent to people. The previous stimulus check, $600. The new one, I think, is $1,400 US that the federal government sends to people. But then when we talk about employment insurance, it has to be done through the states. So the federal government did not take over in the US, did not take over unemployment insurance. It still worked through the existing institutional system that was created in 1935 as part of the Social Security Act. Okay, so this has existed since 1935. The system has evolved over time, but the basic structure in terms of federalism has remained the same or similar. And so that's an example of institutional continuity in terms of what level of government is doing what. Okay, so in that case, when we talk about Canada and the United States, there was there was continuity. In terms of emergency governance, now we are talking just about social policy. If we talk about public health, it might be a different story, right? Because social policy, we talk here about mature welfare states. Some of the policy tools were already there. They were just expanded. I think what will be more interesting when you study emergency governance is to look at public health measures, to look at quarantines, mask mandates, and so forth. To me, that's probably more interesting if the issue you want to know is about emergency governance per se. And this is something, there is a book that will come out at University of Michigan Press by Scott Greer that deals with both social policy and public health responses to COVID-19, which we don't deal with directly in our special issue. And I think public health is absolutely fascinating. What we have seen is countries doing things that they have never done before. Right. So I think there is more discontinuity, institutional discontinuity in public health in many ways than in social policy, at least when I look especially at my two cases, Canada and the US. But I might be wrong regarding the UK or other countries. And it's not a question that we ask in our special issue or in our article on Canada and the United States. But you're absolutely right that, you know, this is not something, and we are prudent in the claim that we make about institutional continuity, because there are examples where there is discontinuity. And back in the previous special issue of social policy and administration I edited was back in 2016. And our special issue was really about continuity and change in social policy. What is continuity? What is change? How you define it? These are key questions in social policy research, especially within institutionalism. We know the work of people like Cathy Tellon and so forth, but this is about incremental yet transformative policy change that takes place over long periods of time. What we are talking here is about emergency. So in our introduction to special issue, we discuss different theories that can help us think about emergencies. For example, in terms of I mentioned crisis Keynesianism. I mentioned there are several theoretical frameworks that we discussed there. And so we don't come up with a definite answer to this, right? We discuss different theoretical approaches. For example, in terms of continuity and change, and we don't say it's all about continuity, but there are clear examples like that, what I mentioned about federalism in Canada and the US, where you have patterns of continuity. But that's in the case of mature welfare states. When we talk about public health, I think I would be much more prudent about this, because I think there is much more improvisation in many ways, more improvisation.
You're muted, Timo.
Sorry, this evening I had 6 hours of teaching. I think my brain is only working half. Gordon, and then Johnny. I think I saw your actual hand rather than the virtual one. Exactly.
Now can I speak something? Okay. Hi, Daniel. Thank you so much. I'm very interested in this issue, and so I really enjoyed this lecture very much. And the question I want to ask here is that can you tell us something about why American performed particularly poor in this pandemic during that time? Actually, as you also mentioned, we all know that there is an explicit answer, and actually we all love that because Trump, because the last government, because the special leader. But I still want to ask, under this surface, very naive answer, is there any institutional factors or reasons that also drives this consequence? And if there exists some, then when we want to conduct some related research, how could we split these factors from the very special leadership, the temporary factor? Yeah, just like that.
Thank you for your question. So in this article, we don't tackle the public health issue, but we do that in a piece that we just wrote, which compares Brazil under Bolsonaro and the US under Trump, with Catarina Segato, Phil Rocco, and Alex Wadden. And what's interesting here, I think, Trump and Bolsonaro, if you take Brazil, I mean, obviously, presidential leadership does matter, but what matters a lot too is the party system, partisan politics. In the US, it's not just Trump, it's the Republican Party. And what's happening in Republican states and what happened compared to Democratic states, democratically controlled states, so the blue versus the red states, you can see major differences in terms of political leadership and in terms of public health responses to COVID-19. Okay, so I think it would be simplistic to say it's only about Trump. It has to do with the federal system, the way it works, but in relationship to partisanship. And what's interesting here, when we talk about the United States, is that, or Canada even, is that it's not federalism in and of itself. There is this discussion about varieties of federalism. Our federalism varies from country to country and in relationship to different institutions. And I'm actually working on some papers about this too. But what's interesting about what we find here is that it's not because you're a federal system that you necessarily fail in terms of public health. It's not because the US is federal that they did so poorly, or Brazil, because look at Australia. Australia is a federal system. It's more centralized than the US and especially Canada, but they did a much better job overall in terms of public health. But it's because of the measures they took very rapidly, a kind of zero tolerance towards the virus in a way. And having lockdowns, as soon as you see a few cases, you saw that in New Zealand too, which is not a federal country, you go with lockdowns as soon as very, very rapidly. You enact them really rapidly. And in Canada, we have seen that in Atlantic provinces, but not so much in other provinces where people, in the name of economic, protecting the economy, they waited for the number of cases to increase before they will enact more constraining measures in some East Asian countries, but also in Australia and New Zealand. What we saw is very bold public health actions, sometimes actions that might be even in Canada or in the US, people would say it's really an attack on personal freedom in a major way. But I think there is something here that's not just about federalism. It's not just even about partisanship, but I think in the case of the US, it's a mix of federalism, partisanship, and also a certain emphasis on short-term economic imperatives rather than longer term. Because we know that if you're very effective at fighting the pandemic, like they've done in Taiwan, for example, or if you prefer, China, Taipei, as they used to say at the Olympics. No, it's Taiwan. So you see, they were very effective at fighting the virus. And that is actually why their economy is doing well. But there is a short-term calculus that you see a lot in North America saying, and we saw that in the UK too, in other countries, we don't want so many people to lose their jobs. So let's wait. The cases are increase. And then, now we panic and we enact these measures. And I think if you're more proactive, you will have a different outcome. And I think this is an issue. And Canada didn't do that well in terms of fighting COVID-19. It did better than the US. But if you compare yourself with the worst or one of the worst players, of course, you may look good. But you have to compare yourself with countries that have done a better job overall. And I'm not saying it's just about public policy. Geography can play a role, other factors. But public policy choices are important.
Johnny, please. The last question for you.
Well, no pressure then. Thank you.
Not at all.
Thank you, Daniel. That was brilliant. I was really interested in your point about how in the US the decentralization and political gunfights between the national government and the states really impeded their progress on social policy there, particularly for unemployment insurance. But on the other hand, Biden has just passed these child tax credits, obviously through the tax system, that's kind of goes past the state governments from a national level. So a bit of counterfactual. Do you think that a Biden administration with a Democratic House and Senate, if they were in power during the coronavirus, would they have found ways to supersede this challenge between the national versus state and got more relief more effectively to people and got past this challenge that Trump wasn't able to?
Ivor's hand just went up. Let's include Ivor in that also to squeeze her. And I said last one for Johnny, but then Ivor's went up. So it would be not nice to not include her. So Ivor, if you shoot in as well, quickly squeeze yourself between Johnny and Daniel.
Great. Thanks, Timo. And thanks, Daniel, for your presentation. You mentioned at the beginning austerity. So I was just thinking about the UK. So after the Great Recession, austerity benefit cuts were introduced, and the Institute for Fiscal Studies and others have shown that if the benefit system before austerity was still in place, that would have protected the incomes of workless households more than the current system, even including the special emergency COVID measures. So looking forward, how to protect poor households, one policy option would be, say, to reverse the austerity benefit cuts, or at least ensure that after the pandemic, no further austerity benefit cuts are introduced. So I was just wondering if that's relevant also in the context of the US and Canada.
Yes, thank you very much. I will answer your question first, then I will go with Johnny. So you will get the last answer if you didn't get the last question. Look, this is a fascinating topic. I agree that, again, when we talk about existing policy legacies, how your welfare state is designed when you enter a crisis will have a major impact on how the crisis is affecting people on the ground in terms of poverty, insecurity, and so forth. So these policy legacies matter. And so the conservative cuts still matter today, even in the context of emergency measures and the pandemic, obviously. And in Canada, we can say too that some of the measures enacted before the pandemic, like in terms of beefing up our child care, child tax credit system in a way that is progressive and redistributive, actually has been helpful since the beginning of the pandemic, although I haven't seen the numbers yet. So existing policy legacies matter even during a crisis. And I think that's where we have to, when we think more in terms of normative ways, how we justify reinvestments in social policy. People like the language of investment. I'm a bit skeptical. It's not just about investment, really, but in part it is, we need to be ready for the next crisis. And permanent measures, reinforcing existing programs for lower income people, for the so-called, essential workers who are so vulnerable, many of which in North America are part of ethno-racial minorities. Even we saw in Canada asylum seekers working in long-term care, emergency, in an emergency role and so forth. We have vulnerable people and vulnerable groups in society, low-income people and so forth. And their vulnerability was exacerbated during this crisis. And now we have to address these vulnerabilities in the long run, because I think it's just better in terms of fighting poverty, inequalities. It will help in terms of public health in the long run. But I think also you can tell policymakers, if you have automatic stabilizers already in place, when there is the next pandemic, you will already have a cushion in a way, instead of trying at the last minute to enact these huge legislation, which will be necessary, but maybe not to the same extent. So it could add a little bit of predictability here. I'm not sure about this argument. I just made it on the fly. I'm not sure if it will work in the UK. You can try it and return to me later. I'm not sure that Boris Johnson will buy it, but maybe that Labour will buy it and other people. But I agree that austerity still matters today, even when austerity measures themselves, or at least, we are beyond austerity in terms of the current legislative process in many countries, but the legacies of these decisions that were made a decade ago or 5, 6, 7 years ago, they still have a real impact on people, and often a negative impact, of course. And then I go back to Johnny, your question. Look, this is an important issue. Counterfactuals are useful in terms of social science and policy research. So you're asking me here about the counterfactual, what if the Democrats and Biden had been in power? I suspect that the content of the CARES Act that was passed on March 27, 2020 will have been slightly different than maybe bolder legislation, even bolder than what we saw. Design will have been different, but I suspect that in terms of unemployment benefits, they will still have trickled down through the states. Because if you go back to what happened after the 2008 financial crisis and under Obama, that's what happened. And so to your counterfactuals, I use a fact from the past in a way to tell you it might not have been that different, especially when it's, in March, things are happening so fast. The focus was really on, using the tools that we have and just expand them. And there is something automatic in the US in terms of unemployment insurance. Federal assistance to the states kicks in terms of emergencies, and they added to this. But my understanding is that it might not have been that different, but what happened after that will have been different. We'll have got a second stimulus bill much earlier than in December, much more comprehensive, and maybe with measures targeting poverty. So I think it will have been a different crisis management in the US if with a Democratic White House and a Democratic Congress. But I'm not sure in terms of the CARES Act itself, it will have changed a lot in terms of what I said about federalism and unemployment insurance in the United States. Thank you for your questions.
Well, thank you, Daniel, for your presentation, and also the time to answer all those questions very, very carefully. Was great. And was a pleasure to have you and really have this North American insight into COVID, and then sort of us here implicitly compare it what we went through here in the UK or people here in their home countries. Many of us are in very different places with COVID, making traveling somewhat difficult, as you know, as a previous world traveler, probably on the highest Air Canada mile T that is available, and being grounded in snowy Montreal, which looks like Christmas to me. Anyhow, thank you very much, Daniel. Thank you very much for joining the seminar, and hope to see then many next week again, when I think Lucinda will be presenting, if I followed the program carefully. See you all next week, and Daniel, if you didn't have lunch before the presentation, then a belated lunch in Montreal, cheese and wine. Bye bye, everybody. Take care.
Thank you.